Thank you very much. Thank you all for coming, and those who are watching through the wonders of video. Appreciate your time. I'm Jeff Waxman, as I said, and I'm going to try in the next hour and a half or so to maybe address some issues regarding men's health, offer some thoughts on maybe screening tests and ways that you can make your life the best version you possibly can, and also try and debunk some ideas that may be floating around in the stratosphere that you may have heard that may not necessarily be accurate. Case in point, I just opened my email today. This slide did not exist about an hour ago, and I couldn't resist sharing it with you. This email says, if you can't read it, if you're over the age of 45, then right now your prostate is about the size of a lemon. But here's the crazy thing. In your 20s, it was the size of a walnut, which means in the past 20 plus years, your prostate has nearly tripled in size. Oh my God. It's so large, it's putting pressure on your bladder, leaving you with that constant need to pee feeling. Plus, it's actually blocking blood flow to your you-know-what and making it impossible to get or stay hard. That's the bad news. The good news is, if you click on this link and you have the intestinal fortitude to watch a 45-minute video, at the end of this you have the privilege of paying about $250 for a supplement with no scientific data whatsoever to stand behind that will resolve your issues. It's incredible what's floating out there. Prostate problems, low testosterone problems, and what I'd like to do over the next hour or so is maybe give you some science and tell you how a practicing physician approaches some of these concerns. Right off the bat, yes, there are a tiny group of elderly men with very large prostates, but not all of them. So does everybody over the age of 65 walk around with a lemon right here between their legs? The answer is a big fat no. Who am I? Well, what's my credibility? Well, I didn't go to Texas A&M University, but I got here as fast as I can. What can I say? I grew up in Houston, Texas. As an undergraduate, I attended Yale University. I saw the light and returned home to Texas and went to medical school here. I did my residency training at Walter Reed Army Medical Center in Washington. And since 1988, I've been in the Division of Urology at Baylor Scott & White in Temple. So I am on the faculty of the medical school in both the Department of Surgery and the Department of Pediatrics. My focus is urology. Currently, my focus is actually pediatric urology, but I've been taking care of big people since 1985. And for those of you who do not know what a urologist is, when I went to medical school, I had no clue. A urologist is a specialist who takes care of problems with the urine system and the male reproductive system, the prostate, penis, issues of that nature, issues that primarily revolve around the need for surgery. So I'm a surgeon. If you have cancer, I may be the person who removes that part of the body to hopefully cure you, deal with kidney stones, congenital issues, the whole swath of issues that can involve the urine system and need surgery. And I am happy to be a part of Living Well Aware. Living Well Aware is the group that was established with my wife, Patricia Shulock, to promote wellness, and we've been working hand in hand with Texas A&M over the last year or two to spread the word and offer our thoughts on how you all can be the best version of yourselves. But before we begin, again, I would like to honor those of you here in the room with me. Thank you for taking time out of your busy schedule to come here. For those of you who are online, thank you also for taking time to tune in. Maybe there will be one or two pearls that you take away from this that will be useful as you go forward. And as I was saying earlier, if you have a question, by all means, fire it at me. And you don't have to wait till the end. If something occurs to you and you'd like to raise your hand and ask it now, by all means, I'll do the best of my ability to answer your questions. I myself am excited to be here because, as I said, I'm a practicing urologist, so what I'm saying affects me. You know, I'm interested in making a contribution to the health of men, but the good news is it's double duty because whatever I learn can also be applied in my own life. I am a patient. Some of these issues that I'm talking about may have affected me. I am interested in prostate cancer screening myself. I do get PSA tests annually. So what I'm saying here, not only am I suggesting it for you, I apply it in my own life. I'm trying to walk the talk. And I am committing to improve my own health and happiness as well as my patients. And hopefully I am a picture of health. In 2 months I will turn 64 years old, getting close to Medicare, and I've been trying to live this wellness message now almost all my life, but really over the last 10 years have I truly focused on those aspects of one's lifestyle that will lead to the maximum that you can get out of this time we have on earth. What I like to say is, this ain't no dress rehearsal. You don't get a second chance. So if you make the most of it now, when at the end of the day, you can say you did well, there you have it. You took advantage of what you had. So what am I going to try and do today? I'm going to review some up-to-date guidelines and recommendations on some of the common health issues that men face. I want you to be educated. And the takeaway from this is question everything. Question those emails that come in your box telling you your prostate is the size of a lemon. Question me. Do I have the latest and up-to-date data? But be skeptical because there's a lot of information out there. A lot of it is bogus. A lot of it is promulgated by people who are interested in doing a wallet biopsy. So be careful about what you read and learn and ingest. I'd like to clarify some confusion. But again, I am not here to provide individual medical advice. I might be able to give you some directions, but unfortunately, I can't be everybody's doctor. So you'll have to take what I say and take the information and your questions, if you have them, to your own personal physician if there's a specific issue that you are concerned about. And again, definitely worth mentioning, general guidelines for screening and treatments apply to the majority of people. However, there are certain specific instances that may not apply to you. So once again, if you have a question, please talk to your provider. So what am I going to talk about? Well, we'll talk about screening tests. What are the things that you should be concerned about? What do we need to be looking for? How do we detect prostate cancer? I'll talk about some male sexual issues. We'll talk a little bit about the physiology of erections. How do you get hard? What happens when things go wrong? What can you do about it? And also some issues regarding a common topic these days, and that's testosterone replacement. I get a lot of questions about, well, doc, could I have low T? Do I need some? And we'll talk a little bit about the other common afflictions that affect the human organism as we get older. Let's just start off with a good question. How often should I go for checkups? Well, that answer actually is going to be variable, but the bottom line is everyone in this room, if you're over the age of 18, should at least go and get started. Even if you're young and you feel really vital and you don't have any aches or pains, you might have high blood pressure and not know it. You might have a high cholesterol level and not know it. And these issues could be affecting your body silently and worsening conditions as time goes by. So the bottom line is, get your first checkup, and depending on your age, your provider can tell you what you need to do going forward in terms of frequency. But anybody over the age of 18 should go in for at least an initial checkup and at least start getting your blood pressure checked and maybe a few baseline blood tests and things such as prostate cancer. You don't have to worry about that when you're in your 20s and 30s. But when you start getting older, that's when that type of issue kicks in. I myself, as a 64-year-old almost, I've been going to my doctor about once a year now for, a good 10 years or so. I like monitoring all of my vital functions, my blood pressure, my heart, my kidney function, my blood count, my prostate. So I want to make sure I stay on top of things, because I remember what Benjamin Franklin said: an ounce of prevention is worth a pound of cure. And I firmly believe that. Excuse me. When we talk about screening, these are based on the common causes of death. We don't want to screen for very rare diseases, because economically, in terms of cost and time, it's just not worth our time. We want to go where the money is. So if we want to worry about the common causes of death and help you minimize the likelihood that that happens to you prematurely, we need to know how people die. In this country, about 2.6 million Americans die every year. Does anyone here know what the most common cause of mortality is amongst Americans? Any thoughts? Yes?
That's what I was going to say, cardiovascular.
Cardiovascular disease. You didn't need to come here. You could be up here teaching this. Yes. Heart disease is the major killer of Americans, and over 600,000 people per year die of heart disease. So that, of course, is going to be where our major focus is. We want to prevent heart disease. The number 2 killer is cancer. And there are a variety of those, and I will go over a few statistics and graphs with you as we proceed. Chronic lung disease is next. And that's primarily, of course, in smokers. And the good news is that number is diminishing, because the number of people who are smoking in this country is declining. But it is still an issue. Accidents are up there as well. And rounding out the top 5, stroke, cerebrovascular diseases, which also, of course, are intimately related to heart disease by virtue of the fact that high blood pressure and issues with cholesterol can affect both of those disease processes. So how do we want to prevent heart disease and stroke? Essential element number 1 of the Living Well Aware 11 essential elements: normal numbers now. This is one of the reasons you go to your doctor for your checkup. You want to make sure your blood pressure is within the range of normal. You want to have your cholesterol value checked, and those are what these lipid values are. LDL is low-density lipoprotein cholesterol, and we should want that to be as low as possible. HDL is high-density lipoprotein and triglycerides. We want to screen for the possibility that you might have diabetes, which in this particular age is a rising problem in America, coincident with the increasing problems with obesity in this country. So you want to have your blood sugar measured. And you want to have your ideal body weight calculated, so that if you're not close to that, your doctor can give you advice on strategies that you might want to consider as you try and achieve your ideal body weight. And depending on your situation, if he feels there's a need for looking at your heart a little further, you may get an EKG or a stress test. Or if we need to check out your lungs, you may get a chest X-ray. But the bare bones, when you start out going for regular checkups, will be to have these parameters monitored, especially your blood pressure, especially your cholesterol levels, especially your blood sugar. Let's find out whether or not these are issues you need to start working on, because when corrected, they can certainly prolong your life and reduce some of the diseases or the morbidity, the issues that these diseases cause later in life. What about cancer itself? What screening tests are recommended for cancer? Well, what are the cancers we need to be worried about? These are new cancer cases in this country last year. New cancer cases. And prostate cancer is the most commonly discovered cancer in this country. And let me also point out, though, It is the most commonly diagnosed, but it is not the main cancer killer of men. We'll go over that in a minute. The second most common cancer we find in men, lung cancer, because smoking is still an issue. And rounding out the top three, cancer of the colon and rectum. And we have ways of looking relatively cheaply at all of these three to find out if this should be a problem you need to worry about or not. Notice with females, breast cancer is number one, but also with females, the number one diagnosed cancer is not the number one cancer killer. These are the cancer killers. Lung, for both men and women. That kills more Americans each year than any other malignancy. Prostate is a distant second place at 9%. So the good news is we have ways of managing prostate cancer if we find it, and in addition, it is far less likely to kill you than some of the other issues we're talking about. And in fact, let me just emphasize this one more time. A lot of us are definitely worried about cancer. We don't want to be told that we have cancer, or if we do, we want to jump on it early so we can fix it. But that's not really the main worry we should be considering. We should be much more worried about cardiovascular disease and stroke, because those problems are far more prevalent. That's where the money is right now, and that's where you should be expending your time and effort if you're considering modifying your lifestyle to be as healthy as possible. Worry about the heart. Yes, you can worry about these things, but they are in second place. So for men, what do? Prostate-specific antigen is a blood test. PSA is a chemical, an enzyme manufactured by the prostate. So it's pretty easy. You go in, you get a blood test. We'll go over which men might want to get this blood test in a minute. Let me caution you that this test, as with all screening tests, have imperfections. The PSA is not perfect. What I mean by that is, if your PSA is high, that might mean you have prostate cancer, but it also might not. Other issues, such as infection or an enlarged prostate, may contribute to an abnormal screening test. On the flip side, you may get a normal test, but you might have cancer. So none of these tests are perfect, and we are working on ways to try and refine these tests so they become more accurate in our hands, but right now, this is the best we have. For men and women, colonoscopy is also recommended. That is the best test to undergo if we're trying to detect colon cancer. And usually, that is not something that is recommended for younger people. When you're in your 50s and beyond, that's about the time we start recommending that such a test be considered. Colonoscopy, for those of you who do not know, involves taking a long, flexible telescope. It's inserted in the rectum, and the gastroenterologist specialist who's monitoring that has a camera. He guides that all the way through your rectum up to your intestines to inspect for polyps or possible growths that might indicate a cancer. I've had 2 of those in my lifetime. I can't say it's the most fun experience in the world, but I walked out of there confident after the inspection, knowing I'd done something good for my health, and I found out and was reassured that there was nothing there to worry about. Smokers might undergo further testing to look for lung cancer. When physicians look at smokers, we use a metric we call pack years. How many packs a day did you use every day? How many years were you a smoker? If you smoked 1 pack a day for 10 years, you have 10 pack years. If you smoked 2 packs a day for 15 years, you're a 30 pack year smoker. The studies necessary to screen for lung cancer are generally reserved for men with 30 pack years in their health history or more. So if you've been smoking half a pack a day for 5 years, I would suggest you consider a strategy to stop, but that's not the kind of individual where I'm going to be worried about lung cancer. They are not the ones who are going to undergo such a test. And here's good news. cancer death rates are going down. And part of that is due to a reduction in smoking. Part of that is due to these screening tests where we are picking up these cancers at an earlier point in their development. And the earlier we pick it up, the easier it is to eliminate. Looking at men, there's been a dramatic drop in lung cancer death rates because of the cessation in smoking. You can also see that prostate in yellow is going down, and that too is due to screening. Now you might ask, well, why is there a peak in prostate cancer deaths, say around 1990, 1995? Why is that? That may have to do with the fact that that's around the time that screening tests were initiated, and at that time we were picking up a lot more cancers that were heretofore unrecognized. So once new tests came in, we started doing them, we got a rise in detection, and a rise in, of course, patients we were monitoring with this problem. Now that we've had PSA screening for a long time, we can see that it's having an impact, and that's going down. But this is a controversial topic, and I will go into that as we proceed, because there are some folks who feel that PSA screening is overblown, that maybe we're finding too many prostate cancers, because we know prostate cancer in elderly men often grows slowly. It's not going to harm your health. In fact, it probably would be best in certain men if they didn't even know they had prostate cancer, and we left it alone because something else is going to take them up to heaven. But at any rate, I'll get to that controversy shortly. One other thing I do want to point out, and this is a little bit disconcerting, liver cancers are going up. And pancreatic cancer is going up a little bit as well. Why is that? There are probably some environmental factors in there that are not yet undetected. Definitely, alcohol consumption is a problem in this country. The rates of liver disease due to alcohol use are increasing, and I'm sure that that probably has some indirect impact on why there are more liver and hepatic cancers being uncovered.
Could that be related to hepatitis C or any of the hepatitis factors?
Good question. The question was, could the increase in liver cancers be related to the hepatitis C virus? And the answer is yes, it is. So we talked a little bit about screening tests for cancer. For prostate cancer, there's a blood test. If you're concerned about colon cancer, there's the colonoscopy. Lung cancer, chest x-rays, or the radiographic test known as a CAT scan is also highly thought of as a screening test in smokers. Other screening blood tests are done for other health issues, not cancer. You want to get a complete blood count to make sure that your blood count is up and that you are not anemic. We want to know what your liver function is like and your kidney function, so that if there are issues with these organs, they are picked up early. We want to know if you have enough calcium in your system as well as protein. And for men, and also primarily for women, we want thyroid function tests, because that's a common problem in the female population. So for a middle-aged gentleman going in for a complete physical examination, it is highly likely that your doctor is going to want to get these tests as well. And they do encompass what I get when I go for my annual checkups. So let me say a few words about prostate cancer. And I'm going to use some slides that were downloaded from my professional organization, the American Urologic Association. Some of them are a little bit detailed and focused on healthcare providers. I'll try and translate for you as we go along, so when you see these slides, don't freak out. What's the bottom line? Prostate cancer is very common. If you'll notice in the third bullet, about 1 out of 7 U.S. men will be diagnosed with prostate cancer during their lifetime, and about 3% will die from the disease. That's about 30,000 men. That means that a huge number of men will be uncovered with prostate cancer who will either be cured or merely monitored, because in them, the prostate cancer will not felt to be a serious health threat. Over 60% of new cases are diagnosed in men over the age of 60. The mean age is 67. For those of you watching here and online, that means if you're in your 30s or 40s, not your concern just yet. You don't need to focus on that probably until you're in your 50s, with the exception being whether or not a family member like your father or a brother had prostate cancer. Once again, let's look at this issue of screening because it is controversial and there's been a lot of information around the urology community regarding screening for prostate cancer. Why do we want to screen? We want to find cancers that might kill you, bottom line. We'd rather not find indolent cancers that'll have no impact. But we don't have a great test that's going to specifically tell us who's got the deadly cancers or not. In 2013, my professional organization, the American Urological Association, recommended this. If you're under 40, we do not recommend screening. We do not. There's no point. Prostate cancer usually does not appear at that age. It's a waste of your time and money. If a test is falsely elevated, then that's going to cause a lot of anxiety and additional testing that you otherwise might not have needed. It's not recommended, additionally, if you're between the ages of 40 and 54, with the caveat being if a family member has had prostate cancer at an early age, you might have some type of genetic predisposition. You might be one of those folks we would want to look at. But generally, under the age of 54, we're not too worried about prostate cancer. If you're 55 and over, say up to about 69, the decision is yours. You have to weigh the pros and cons with your doctor, who will go over the benefits of screening versus the possible adverse consequences. And in fact, we also are saying if we want to reduce the unintended consequences of false positives and the harms of screening, maybe this is not something you need every year. Maybe this is something that would be best done every 2 years. Now, as you get older, the other problems affecting our lives, such as cardiovascular disease, become much more prominent as health threats. For that reason, after the age of 70, we feel that routine screening for prostate cancer is probably not indicated. It's not that important. If we found prostate cancer after that age, it's highly likely it would grow so slowly it wouldn't have an impact on your lifespan and thus might not even be treated. It might only be monitored. Now, that's a generalization. If you're an incredibly healthy 75-year-old and your grandfather is in the room with you and he's 110 and he brought you to the doctor, you obviously are destined to live a long, healthy life if I-35 doesn't get you and you have a car accident. So in men who have a predisposition to living much longer, I'm not saying don't get it, but I am saying that the odds of you needing treatment for prostate cancer will decline if we find that you have that cancer and you're over the age of 70. Now, I used to say that over the age of 70 was old, but now that I'm 64 almost, getting to be 65, old is about 100, 110, but 70, that's...
I remember being 64.
You remember. So you agree with me, right? So what's your definition of old?
Haven't been there yet.
Hadn't been there yet. You know, my father-in-law, who passed away at the age of 94, made the same comment. He said, I don't know what old is. Now, in this country, fewer men are being screened for prostate cancer. This is where the controversy arises, because in 2012, another group, the U.S. Preventive Services Task Force, a volunteer organization, recommended no PSA screening. Their argument, there is no net benefit. And the more you do it, the more you're going to cause harm and perhaps do unnecessary cancer surgeries, unnecessary prostate biopsies. You're going to cause more harm than you're going to benefit patients. This is, as I said, controversial. And a lot of this, of course, is based on studies done in the medical literature. One study found that there is no reduction in deaths due to prostate cancer if you do screening. But this study was flawed. There were methodological problems with the study which caused their data to be questioned. Remember at the top of this I said question everything. Even a journal article in a respected medical journal has to be questioned because the authors might have some unintended bias. And if they have an unintended bias, that can also all of a sudden become accepted as fact without even being recognized. There are other studies that show just the opposite. The study out of Europe that looked at this found a statistically significant reduction, a 21% reduction in deaths due to prostate cancer with screening. In another study, cancer mortality was reduced by almost 1/2 when looked at over a 14-year interval. So there is other data in the medical literature that supports the fact that screening for prostate cancer will indeed find those cancers that could be killers, and if we attack that early, we may save you from prostate cancer death. So again, there's evidence against, there's evidence for, and this is a controversial subject, but the American Urological Association, of which I belong, suggests that routine prostate cancer screening is probably of more value than harm. What do? I get a PSA every year. And mine's 0.4, which is a nice number to have. So I believe that at least in this age group, it is valuable. Now, when I'm in my 70s, will I still want to get a prostate cancer PSA blood test? I don't know. I haven't gotten to that point yet. I may not. But at this point, being in my mid-60s, the answer is a very firm yes. Would anyone like to ask any questions about prostate cancer at this juncture before I move on to another health issue? Yes?
Just one comment. I had routine screenings of both digital exam and PSA test.
Excuse me, someone is calling me. Let me just decline that call. Go ahead. I'm sorry, start over.
All right, routine screening. My PSA was always normal, but my cancer was detected by digital exam. And so I have no prostate now, which is a nice feeling, sort of. But we still do the PSA test because if there's any PSA antigen shows up in me, that indicates that maybe some cells got loose.
Let me repeat what you said for those who are listening online. This gentleman was saying that he had PSA blood tests and they were all normal, but he was found to have prostate cancer because he had a prostate examination. And I'm so glad you mentioned that, because I neglected to mention the fact that that's part of a thorough physical examination. A blood test alone when you're looking for prostate cancer is not complete. Every man going to see his physician once they're in the age of 50 or above should have a rectal examination, not only to see if there might be a bump or an abnormal area of hardness on your prostate. That's another way we can find masses within the rectum, rectal cancers. It's a way we can do a test for what we call occult blood, a test that will find out if there's any bleeding coming from your intestines that you might not be aware of. So a physical examination with examination of the prostate is part and parcel of thorough health maintenance. And I'm so glad you mentioned that. So glad you mentioned that. And in fact, that's distressing to me as a specialist, because sometimes I see patients who have been sent to me for evaluation for a variety of issues, and I look at what their internist or their family physician has done when I see the record, and I find that they have not done a rectal examination. Gentlemen out there, here in this room and online, if you go for a physical, it's not complete until you've had a rectal examination. So glad you mentioned that. ED. What's that? Erectile dysfunction, which is the new and politically correct word, whereas in years past when I was a young urologist, we would say impotence. problems with erections. And I'm going to go over some things, and I'm not going to get too complicated with this, but I do want to mention a little bit about how erections take place, what's involved, and that will also help you understand what some of the methods are that are used to treat erectile dysfunction. For a man to have an erection, you need a few things. Number one, you need an awesome, sexy partner. That helps. You need visual stimulation, you need psychological stimulation, you need input. But because before the physiology starts, you have to have a reason. You have to have a why. My why is right next door talking about women's issues. What happens after that? Several things have to work right for you to get an erection. Number one, nerves. Nerves are your body's wiring. They're all over your body, of course. Nerves go to your penis. Nerves release chemicals that pass through or infiltrate into the area of the penis to affect muscles and arteries and veins, and that's what starts the process going. Nerves. For those men, for instance, who have had surgery down here, perhaps prostate cancer surgery, it's very possible those nerves might have been injured, and those men may have problems with erections purely because the messages carried by nerves are no longer getting to where they have to go because they've been transected. So you need nerves. And you need arteries and veins. What is an erection? An erection essentially involves the penis filling with blood. And within the penis, there are two elastic chambers, corpora. They're like water balloons, except they're covered with a stretchy elastic material. These paired balloons, if you will, fill with blood, and that's what causes an erection. So you have to have arteries open the floodgates, if you will, so the blood will rush into the penis and fill these two corpora, these two balloons. Not only that, arteries bring blood in, veins drain blood out. Veins that ordinarily would bring blood out of the penis have to shut down and close the floodgates so more blood is going in and less blood is going out. That's how the erection is maintained. So you start with nerves, they transmit a signal, arteries and veins start working to bring more blood in, less blood out. And then chemicals. As I was saying, the nerves release chemicals, and one of the chief chemicals is an agent called nitric oxide. Nitric oxide starts a chain reaction of events which ultimately culminate in the process we know as getting hard. Nitric oxide stimulates an enzyme, and the bottom line is we get a magical chemical called cyclic guanosine monophosphate, CGMP. That's the magic juice. And when you have large quantities of guanosine monophosphate, that helps muscles in the penis relax and open the doors for more blood to come in. And as more blood comes in, that helps to shut down the veins that would take the blood out. So it's a complicated series of reactions involving nerves, chemicals that beget more chemicals, arteries that open up, veins that shut down, all in the presence of stimulation in an environment that's hopefully free from anxiety, worry, and stress. That's the magic potion. And in fact, it is, well, I'll just mention one other thing. All of the processes in the bodies are, if you will, auto-regulated. Certain chemicals are released by the body but then the body has fantastic mechanisms for degrading those chemicals so that whatever is happening doesn't go on indefinitely in an unregulated fashion. Just like hormones in other areas of the body, here there are structures in the penis that are designed to actually break down cyclic GMP so you don't walk into class with an erection that is noted by everybody. And the enzyme responsible for breaking down this magic juice, cyclic GMP, is an enzyme called phosphodiesterase type 5, PDE5. I mention this because many of the medicines that are given by physicians to treat erectile dysfunction, this is where they work. They inhibit this enzyme, they inhibit the breakdown of this cyclic GMP, and they halt the process of erection reversal and keep the erection process going and going and going until you have an orgasm. Then everything is indeed reversed. So again, selective inhibitors of PDE5 such as Viagra, probably the most well-known, work by inhibiting this enzyme phosphodiesterase 5. So when we talk about ED, what am I saying? I am defining this as you can't obtain or maintain an erection firm enough to have sex. Now, this is very specific, and I often see patients who come and say, I have ED. And so I'll say, well, do you get erections that are firm enough to have sex? And they'll say, yes, I do. I have sex, and I have an orgasm. Then it won't go back up. I have ED. That is not ED. That is called normal physiology. You laugh, but I have seen this more than once. Again, it is a normal reaction after an orgasm for you to have an interval we call the refractory period where no matter what, you are incapable of having an erection again. It's shorter in younger people, older in 63-year-olds like me, but that is normal. So I am specifically talking about those men who are trying to have sexual relations and they are unable to have a firm enough penis to allow for penetration. That's what I'm talking about. This can be organic, psychogenic, or mixed. Organic erectile dysfunction is due to disease processes that affect that mechanism I just outlined for you. For instance, diabetes is a well-known disease that affects erections, both because of its impact on the nerves of the body, as well as its inhibition of normal arterial and venous operation. It gets in the way of your blood vessels working properly, it gets in the way of your nerves working properly, and in many instances, it will affect your ability to have erections because of that. Other problems, cardiovascular disease. If you have atherosclerosis, hardening of the arteries are not going to behave the way they're supposed to, or the veins may not behave the way they're supposed to. All of these things could be real physiologic processes that inhibit your ability to have an erection. On the other side of the coin, there's psychogenic. Maybe you're built completely correctly. Maybe there's nothing wrong with your physiology, but maybe it's the stress at work, a relationship that's not doing well. There's anxiety on your part. Maybe you had an erection the last time, but you're worried that you may have one this time. Or maybe it's a combination. Maybe you're having some mild problems because of some vascular disease, and you had some issues the last time you had sex, so the next time you're thinking about it, you're thinking about it, and even though your body is capable of having an erection, your mind is getting in the way, and that's just as serious a factor as the vascular issue. So often what we have on our hands is a combination of both. When you look at the physiologic causes of erectile dysfunction, by far and away, vascular diseases and hardening of the arteries is way up there. Diabetes is in second place. Medicines. Doctors often prescribe medicines for very good reasons. You may have high blood pressure and you're required to take an antihypertensive. Some of those drugs may also impede the erectile process. You may have some type of psychological problem, maybe anxiety or depression. Some of the medicines that are given for those issues also will have an impact on normal physiology. So those are the three main reasons for organic erectile dysfunction, and it's my job as a urologist, if you're coming to see me, to try and uncover these possible etiologies so we can try and figure out the best way to either deal with it and fix it or work around them. Some of the medicines that get in the way: 5-alpha reductase inhibitors. These are medicines like Proscar, often given to men with enlarged prostates the size of a lemon. Seriously though, it is given to men with large prostates to try and reduce prostatic size and improve their ability to urinate. But these medicines will affect erectile function. Blood pressure medicines, as I mentioned, psychiatric medicines, even a variety of other medicines such as digoxin, often given for cardiac issues. So when I evaluate these folks, we have to be very thorough. We have to start with a lot of questions. I need to know how old you are. Are there any problems that might hint at vascular disease? Do you have high blood pressure? Do members of your family have problems with heart attacks that might also clue me into that issue? What is your diet like? How often do you exercise? What's your tobacco intake? Maybe your alcohol intake is rather heavy, and that might be having an impact on the situation. Do you use licit and illicit drugs? All of these issues are very important clues as I try and piece together the puzzle when I factor in how am I going to help this gentleman in my office who's telling me he's having trouble with erections. When reversible vascular issues are identified, let's work on it. It is well known that dietary changes can improve your vascular situation. If you have read the Dr. Shulock's book about the 11 essential elements to health and happiness, you are probably aware that the Mediterranean diet is the one diet that research has shown is optimum for maximum health and vitality and prolonging longevity. And the Mediterranean diet also applies here. The Mediterranean diet has actually been shown, if you adhere to it, to help a group of men elevate their testosterone levels. Just as exercise can help to elevate your testosterone levels. So if you are not maintaining a healthy lifestyle and you're having problems with erections, part and parcel, number 1, 2, 3, 4, and 10, work on your lifestyle. Work on your lifestyle. We want to know more specifics about the erections themselves. How long do they last? Do you even get an erection? If you do, is the problem not the ability to get an erection, but the fact that it seems to wane before you have the opportunity to have sexual intercourse or reach an orgasm? Do you occasionally awaken at night with an erection? That might be a useful clue. Have you received any treatment before coming to see me? And what other issues are there? There's some issues with the penis that I deal with. For instance, one called Peyronie's disease that involves the formation of very hard, inelastic plaques on those stretchy balloons I told you about that are within the penis that fill with blood. If those erectile bodies become deformed or they lose their ability to stretch, then yes, you may have some problems of a very real nature because of that process. So I want to know all of these things because I want to do what's right for you. Again, could it be due to a loss of sustaining the erection? Sometimes we refer to this as a venous leak because the system that's supposed to keep the blood in the penis is malfunctioning and is no longer holding the blood in the way it's supposed to. You may be doing a great job of getting it in, but if the spigot's wide open, it's going to go right in and go right out, and then you're hosed. So we do an examination. We measure your body mass index and your waist circumference, because if you're overweight, If you fall into the obese category, we're probably going to work on reducing your weight and a program of weight loss to get you into a healthier physiology. Sometimes that alone may be all that's necessary. We also look for subtle signs that maybe your testosterone production is low. That could be enlargement of the breasts, what we call gynecomastia. We look at the penis, of course. We feel for those firm areas I was describing. We look for any other abnormalities. We also examine the testicles to make sure there are no issues there. Because if the issue is testosterone production, and the testicles make 90% of our testosterone, maybe they're not working as well as they should. Maybe they're a little small, maybe a little soft. Those are issues we can detect on physical examination. And I'll mention it again because it's worth mentioning. A digital rectal examination. Feel the rectum, feel the prostate, and make sure that there are no issues in that particular department. So first, we identify the man with erectile dysfunction. We educate, and we offer you an array of options. We modify reversible causes. Again, if you're taking medicines that might be prone to causing erectile dysfunction, we might suggest working with the doctor prescribing them to find one with fewer side effects that will still accomplish the objective that the medicine was given in the first place. Could we find some problems with thyroid disease or other endocrine disorders? Could it be an element of your diet and your lifestyle? If you're sedentary, we may recommend an exercise program. All of these things combined create a more vital, healthy organism, and the more you're vital and healthy, the less likely you are going to be to have problems with erections. If we worked on all of those elements and we're still coming up against problems, then we go to treatments. And the mainstay of treatment now are the PDE5 inhibitors, meds like Viagra, Cialis, Levitra. Those are probably the three most common ones that come to mind. Each of them are slightly different chemicals. They last in the body for different durations, so you have to be cognizant of that when you use them. You have to make sure that you take them well in advance of your anticipated sexual relations so that there's time for them to get into your system. And by and large, these medicines are safe. Second-line therapies, I won't go into this in much detail, but if medicines aren't working, there's certain products that can actually be inserted or injected directly into the penis. That may sound really weird, but with a very fine needle, it's actually not a very painful process. And when no other process works, and this is something you're really insistent on managing, there can be surgery, implants. But that's a whole nother lecture. So once again, to summarize, we'll deal with risk factors that might affect your vascular system. We want to emphasize over and over again how important a healthy lifestyle is. We adjust your medicines. What about over-the-counter supplements? I'm not going to spend a lot of time on that. If you are interested in perusing that further, just Google ergo supplements for erectile dysfunction and you'll have enough reading to last you for a week or two. Seriously, I'm not going to deal with this for a couple of reasons. Number one, I'm not aware of any really well-designed, randomized, placebo-controlled studies that show me that one herbal supplement is outstanding as opposed to others as a treatment for erectile dysfunction. The other thing about herbal supplements is they're unregulated. The Food and Drug Administration classifies herbal supplements as a food product. It's not a drug. And if it's classified as a food product, it does not have to be regulated. Quality control is poor. The person manufacturing this can just about slap whatever they want on the label and say, here, take this. What that means is that you might not be getting the amount of the supplement you think you are. You may be getting a poor quality of the supplement. You may be getting the supplement mixed in with other chemicals that you don't even know you're getting. So for all those reasons, it's unwise to try and treat this with herbal supplements. It's the wild, wild west out there. caveat emptor, use at your own risk. These are just not treatments that I can recommend. Here are the PDE5s, as I've already mentioned, and they work. In fact, it's really interesting to me, Viagra. Does anyone know how Viagra came to be a treatment for erectile dysfunction? Very close. He said blood pressure medicine. It was being used for pulmonary hypertension. Studies were being done for men with blood pressure problems and lung issues, and they were given Viagra to take. Well, you know, when these scientific studies are over, the study's over, you're supposed to turn in your medicine that's left over and move on. The patients in this study refused to turn their medicines in. And the researchers were astounded. Why are you not giving me back your medicines? And they found out that these men were enjoying the fact that there was a side effect of this medicine that they didn't realize that they were having better and better erections. They didn't want to give up their study medicine. That's what led to the ultimate discovery, research, and where we are today. So through a serendipitous event, if you will, we have all these treatments. Let me just say a little bit about contraindications. Who should not take a medicine like Viagra? There's one strict, no argument, no questions asked contraindication. If you have a heart problem and you must take a class of medicines called nitrates, that plus these medicines such as Viagra or Cialis will have very severe reactions to drastically lower your blood pressure, and that could be very, very dangerous. So men with heart trouble who are considering this must be cautious, especially if there's a chance they may be taking nitrates. The other thing is, when the physician prescribes this, we've got to look at you and your health status. If you're in great physical shape and we think that sexual relations is okay for you, we can write you a prescription. If you're huffing and puffing because you climbed one flight of stairs to get to my office and you can barely breathe and you're out of breath for the entire visit, I'm not sure if you have the stamina, and I'm not sure it's safe for me to actually suggest that you engage in sexual relations. We might want to work on your lifestyle first. So, any questions about what I've had to say about erectile function or dysfunction? Question.
Recently I've seen a lot of ads in the Houston paper for clinics that are doing something called a pulsed ultrasound therapy or various variations on that, supposedly exposing the penis to ultrasound, and it's supposed to increase vascularization. Can you comment on whether this is snake oil or not?
The question revolved around advertisements for therapies for erectile dysfunction that involve pulsed ultrasound. I am not aware of any good studies that reveal that this actually has a beneficial effect. I don't know of any studies where it has been compared, for instance, to a placebo and shown benefit. And as you probably well know, there's the element called the placebo effect. If you give a sugar pill to somebody and tell them it's going to cure their problem, there's about a 30% chance in many instances that problem will get better just because of the placebo effect. So you've got to be very careful in evaluating these, and I am not aware. Ultrasound studies are sometimes occasionally used by physicians looking to diagnose an erection problem. If they're worried that it might be vascular in origin, ultrasound might be a specialized test that doctor might recommend. But as a treatment to eliminate erectile dysfunction, I think not. Yes, a question in the back.
With the different prescriptions that you mentioned, the three leading ones, you see this long list of adverse effects to it. And I'm sure that's the legal part of it, the lawyers putting their 2 cents into it. But how do you monitor whether you're falling into that category or not?
The question dealt with how you know to monitor for adverse effects when taking medicines such as Viagra. And actually, it's pretty easy. The most common ones you'll know right away. Headache, which may actually go away with repeated use of the medicine. You may feel a bit flushed, maybe a stuffy nose. Very rarely, some people may look around and actually things look a little bluer. So the main side effects, the adverse events associated with these medicines, are quite obvious and fairly immediate, and you'll know it. So it's easy to monitor those. And it just depends on how bothersome they are to you, but if they're not bothersome enough, I mean, they're not causing detriment, they're not harmful, they're annoyances. So it's not something where if you experienced it, I'm not saying you can't take that medicine going forward. But those are, and in my own personal experience of prescribing these medicines, it is very rare that I hear folks come back and say, I had this. Of course, it can happen, but these are uncommon. But headache is, I think, the most common. I couldn't resist this. Those of you far away can't see this, but this is your good friend, the internet. Look at that six-pack. We're going to talk about testosterone. What it says is, we know what you are experiencing. This is Action Men's Health. Are you 30 years of age or older? Are you feeling tired all the time? Feeling a lack of motivation and well-being? Are you struggling to build and maintain muscle? Are you experiencing a lack of libido? Feeling depressed and reclusive? Then you may have low testosterone. Click here, get our free consultation. Our doctor can send you testosterone and make all these problems go away. Heard that before? Part of the reason that this has become controversial is because so many physicians are out there, or organizations, or people looking to grab a dollar, and pointing out that these symptoms, which could possibly be symptoms of testosterone deficiency, they want you to buy their product. It is the proverbial snake oil. All of the things I've just said. You know, if I've been working really hard, yes, I am tired. If I've been dealing with a lot of paperwork and a lot of patient phone calls, sometimes I might get depressed. I'm over 30. Am I feeling a lack of motivation? Sometimes I am. Sometimes if I didn't get a good night's sleep. All of these things. A healthy lifestyle will correct most of these. And I guess I should say, here I am, not too bad physical shape, 63, almost 64, and I am not receiving testosterone. And I'm feeling excellent. So just, again, be very careful. A little bit about how testosterone gets to us. Again, the body is just an amazing system. It is so intricately designed with processes that proceed in a stepwise fashion that are also self-regulating through negative feedback loops. These processes are controlled and they just don't go on in an uncontrolled fashion. We get testosterone from our testicles, 90%. But the testicles don't just make this chemical. They have to be told. And they are told through the pituitary gland, which makes a chemical called LH, luteinizing hormone. So luteinizing hormone comes from the pituitary, it circulates through your blood, gets to your testes, and your testes get the instructions to make testosterone. But it's more complicated than that. What tells the pituitary to make luteinizing hormone? Further upstream, our hypothalamus within the brain makes a product called gonadotropin-releasing hormone. So gonadotropin-releasing hormone, down to the pituitary makes luteinizing hormone, goes to the blood, testicles, testosterone. And when testosterone goes through the blood and does all these wonderful things for our bodies, it also goes back to the brain to tell the brain, okay, we've got enough testosterone, you can shut down for now. You don't have to tell me to make so much. So it's a continual, beautifully well-regulated loop. That also means that for problems to arise, they could be occurring at many steps along the path. You could have a problem with testosterone production because your testicles are not functioning. You could have a problem because the testicles are not receiving the message from the pituitary. The pituitary may not be receiving the message from the hypothalamus. And in fact, as a very young urologist, that is exactly how I uncovered a particular problem in a patient of mine. When I was serving in the military, a captain came to me who was in his 30s. And his message to me was, I'm not having erections the way I used to. And his testosterone was low. And I'm the one who found his brain cancer. So that's an outlier and an unusual element, but it does point to the intricate way all of these systems are in a very delicate balance. So we have several categories that essentially tell you what I've just told you. If the testicles, the factory isn't working, we call that primary. If the testicles are fine, but they're just not getting messages, or some other element is affecting the synthesis, we call that secondary. It's actually not all that common. Depending on how you define it, could be 2 out of 100 men, could be 39 out of 100 men. And take this with a grain of salt because it's going to depend on the study you read, the age of the people they are surveying, their ethnic backgrounds, a whole mix of things. But the bottom line is, if you think your testosterone is low, from my point of view, it is my job to A, find out whether or not what you're telling me is consistent with a low testosterone, and B, prove it with measurements. If I can't do those two things, then perhaps that lack of libido, that decreased motivation, that poor sleep, you're not getting muscles, well, maybe you're not exercising. There may be another reason. Now, there are certain conditions that do elevate the likelihood of a low testosterone level. OSA stands for obstructive sleep apnea. If you have a partner and that partner keeps telling you you're snoring all the time, maybe you have obstructive sleep apnea, and that condition is linked to a low testosterone level. Obesity. Men who are in shape are far less likely to have a low testosterone than men who are far overweight and have a high BMI. Diabetes, high blood pressure, chronic obstructive pulmonary disease, lung disease due to smoking, HIV, kidney failure. All of these diseases are definitely associated with a low testosterone. That doesn't mean you're going to get one, but it does increase the likelihood. In fact, about half of men who have diabetes and are morbidly obese have serum testosterone levels less than 300, which in many instances is felt to be the baseline level for deciding that indeed your testosterone level is low.
What is metabolic syndrome?
Say that again.
What is metabolic?
What is metabolic syndrome? That is a state of being overweight because of the body's problems with processing the nutrients you are taking in. Medicines can also affect testicular production of testosterone. The LHRH agonists are drugs primarily given actually if you have prostate cancer, but also men taking high-dose steroids. Opioids can have an effect. And anabolic steroids. If you are a bodybuilder and you are taking steroids to build your muscle mass, that also contributes to sending signals to your brain to shut down the production of testosterone, and your testicles will no longer make it. And at this point, I may mention it again, but I want to mention it now because of its importance. This is a huge issue in young men who are especially interested in maintaining their fertility. If you are taking steroids, or you think you have low testosterone and you are seeking supplements, those exogenous supplements that you're taking in are going to shut down your body's natural processes, and that may have some permanent impact on your ability to father children. So be very, very careful about testosterone or steroid supplementation, especially if you are of childbearing age and you want to have a family. Be very careful. So again, these are indeed true signs of testosterone deficiency. You do feel as if you have diminished energy. You're tired all the time. You could be depressed and irritable. It may affect your thought processes. You may find that your motivation is reduced. But of course, keep in mind that there's so many other elements in our world that could cause these. Testosterone deficiency is an infrequent cause of this, but it is a cause. Other also very important physiologic things that can happen when your testosterone is low. It may affect your body's metabolism of bone, and you may have decreased density and a propensity to have fractures. So this could be a contributor to osteopenia or osteoporosis. It could affect your ability to build up muscle. It could cause some breast enlargement. It could reduce the size of your testes if you have a low testosterone level. And finally, testosterone does have an impact on the bone marrow, which manufactures your red blood cells. So a testosterone deficiency might be one of the reasons that you might be anemic. So if someone comes to me and says, "Doc, I think I need some testosterone," then I'd say, "Dude, we got to start at the top. I've got to ask them what they're feeling. I've got to catalog these symptoms. And as I'm doing this, I also have to look for any other possible explanations for their symptoms. I want to know, do they have any other health issues? Have they had a heart attack, for instance, that makes me think they have vascular issues? Have they ever had trauma or injury to the testicles which might affect the factory? Have they had surgeries? Have they had brain surgery that might affect the ability of the signals up here from getting down here? What is their job? Do they work in a situation where they're exposed to chemicals or other elements that might affect this whole process? It is a very thorough evaluation. It's just not a matter of, well, you said you're tired, I think you've got low testosterone, let me write you a prescription. It does not work that way. We do an examination. We look to see whether or not the influence of testosterone is present. Do you have hair in the places that men usually have hair? Do you have any breast enlargement? What is the size of the testes? And we do a rectal exam. And we measure your blood tests. Now, this is an interesting feature of our body's design and testosterone production. In younger men, the level of testosterone in your blood differs by hour of the day. It goes up early in the morning between about 6 and 10, and then it declines to lower levels throughout the rest of the day. So if you are concerned about a young man with a low testosterone level, it's mandatory that you measure their blood tests early in the morning. It's uninterpretable if you got it at 4 in the afternoon. And if you're really concerned and the first level is low, you're going to repeat it to make sure that wasn't an error. So testosterone measurements are part and parcel of our evaluation, and we do it early in the morning. Now, in someone my age, the textbooks say that this rise and fall is blunted. And it's not such a large rise, and it's not such a large fall. So if I were to have my testosterone level measured, although my doctor will tell me probably it's best that it's done in the morning, Dr. Waxman, it probably is not so bad if I got it measured, say, at 1 in the afternoon. But this fascinating thing about our bodies is it peaks in most men younger than I early in the morning and then goes down. So we want to measure the level. And if we're concerned at all, then there are other tests we might want to measure. For instance, in the gentleman I told you about, I measured his testosterone level that was low. I'm thinking, he's a 30-year-old captain in the Army, he shouldn't have a low testosterone. The next thing I did was measure the chemicals coming out of his brain. They were low. And I thought, my God, this guy's not making testosterone because there's no signal coming from here. What do I do? The next thing I did was a CAT scan of his head. So a variety of tests can ensue if the testosterone level is low. If the testosterone level comes back normal, then in most instances, the evaluation stops right there, because that's not the right answer. It's some other issue that's causing you to come to me with the symptoms you've described. Now, if we feel that there is a legitimate need for testosterone because your levels are indeed low and you're having all of these issues, then testosterone treatments might be prescribed. And what are the benefits? Well, essentially everything I've just been telling you about that you might complain about will be reversed. Your sex drive goes up. You have more muscle development, less fat. It's good for your bones. You have better erections. Your blood glucose is improved. Your thinking and your mood is improved. There are a host of benefits if legitimately there is a deficiency. One thing that was a bit controversial that I'll touch on with testosterone supplementation is cardiovascular events. At some point early on in the explosion of information about testosterone treatments and how wonderful it was being given indiscriminately, and then some studies came out suggesting that those men taking testosterone might be more likely to have heart attacks. That information, when looked at in subsequent trials, has not been proven out. So I'm here to tell you that it is my understanding, based on the latest literature, that testosterone treatments, if needed, are not going to increase your likelihood of having a heart attack. They are not. But again, if you're a young person and you're interested in fertility, that's the main issue in my mind. If you want to have children, extra supplementation beyond what your body is making is not the right answer. That will be more harmful than helpful. And I'm going to go on. What do we do? Lifestyle modification. I mentioned this earlier. You can actually boost your testosterone through weight loss if you're overweight. Not dramatically, but you can go up about 20 or 40 points. The very same phenomenon can be observed with regular exercise. If you exercise regularly, studies will show that your body's testosterone level will go up. So if you're having problems and your level is hovering near the low end of normal, or maybe just a little bit low, it could very well be helpful for you to embark on these strategies rather than committing yourself to the expense and the hassle of actually taking in testosterone product. Again, all exogenous testosterone therapies result in impairment of spermatogenesis. Your sperm factory is impaired. Don't do this if you want to raise a family. And what can we do? We can give you a gel that you can rub on your arm. We can give you a patch. We can inject it. We have a product that you can insert between your cheek and gums. There are other pellets that can be given. So there are a number of ways that this treatment can be done. First, we decide that the testosterone level is low. Then we tell you what the risks and benefits are, and you help us decide. Then we embark upon a course of treatment and monitor blood levels throughout treatment to make sure we're moving in the right direction. And there's all kinds of ways you can do it. So I've touched on a few aspects of wellness and men's health that are specific. But let me, again, not miss the big picture. As I was saying before, for instance, if you're interested in having as healthy an organism as possible, focus on the main things in America that might kill you, starting with cardiovascular disease. Focus on your diet, your exercise regimen, your lifestyle, whether or not you are a smoker. All those things that are heart healthy will have a spill-down effect for the rest of these elements we've been talking about, but that's actually where the money is. We want you to be well, and the World Health Organization defines wellness. It's the optimal state of health of individuals And it's not just physical, it's psychological, it's social, it's economical, and it's spiritual. But in addition to being all of these things yourself, it's a fulfillment of your expectations in your family, community, university, place of worship, and other settings. So I am very much interested in my physical health. This morning, at 5 o'clock this morning, before I came here from Temple, I got up, I went to my gym, I spent 45 minutes sweating on an elliptical, listening to the Rolling Stones, so that I could be in the best shape possible, both physically and emotionally and energetically, to come talk to you today. So I'm very much interested in physical. Tomorrow morning when I get up at 4:30 a.m. before I have to go do surgery, I'm going to go to the gym and I'm going to lift some weights because that's part of my lifestyle. But it's not just physical. I believe hugely in the psychological and the other elements we're talking about. The other piece in my daily routine before I go to work, I will spend about 15 minutes in mindfulness meditation, putting myself in a state where I'm just focusing on my breath, calming my center, imagining how my day will flow, and putting myself in the best frame of mind so that anything that comes down the pike, whether I expect it or I don't expect it, will be something that I will handle with calm and with courage. So I believe in all of these pieces. We already talked about death rates. I gave you some numbers. Just point out the fact that the death rates for 8 of the top 10 causes of death in 2015 went up. Life expectancy decreased. So the people in this room, by and large, you all look really healthy. I think you're taking care of yourselves. But Americans as a whole, we are not. Life expectancy has actually declined in our country for 3 consecutive years, and that hasn't happened since the flu epidemic of 1918. There you have it. So, we talked about deaths, and that's unique to our country. This is a fascinating and sobering graph. U.S. whites are pictured in red. Our deaths, especially in middle age, are not going down, they're going up. But look at our cohorts from France, Germany, the United Kingdom. Death rates are going down. Something is happening in this country that is not happening elsewhere, and we are not, as a whole, as a population, living well. Why is that? Poisonings, alcohol, liver disease, suicides. Our lifestyle is actually contributing to this diminished life expectancy. And what that means is, the good news is, many of the causes for premature death in this country are very preventable. We're not doomed, but it will require a change in lifestyle. Again, this just shows you, and it's not confined only to middle-aged people, but suicide rates are going up along with alcohol-related diseases in almost all age groups. I don't think we have to beat this to death. But this also has an impact when we're talking about cancer. If you're concerned about cancer, all of these elements are things that you want to pay attention to because they have an impact on malignancies as well. Cancer is caused by cigarette smoking. Cancer is caused by excess body fat. Alcohol consumption in excess is also a well-known contributor to the formation of malignancies. Our sedentary lifestyle. In fact, it is predicted that physical activity will become a more likely cause of death in Americans than cigarette smoking. Sitting is the new smoking. All of these other things, consumption of red and processed meat, a low intake of fruits and vegetables, infections such as hepatitis B and C and HIV, all of these are contributors. And I alluded to the Mediterranean diet earlier on. Adherence to the Mediterranean diet, a diet low in red meat, a diet high in fruits and vegetables will counteract and indeed promote the healthier lifestyle and a reduction in cancer formation. Question, yes?
Has there been any studies on vaping?
On vaping. If there have been, the question was, are there any studies on vaping as a health risk? And the answer is, to be honest, I don't know. My suspicion is that it's such a new phenomenon that there hasn't been enough time for us to see what type of long-term health impact it will have. So I have a feeling there will be people who look at that, but it may be a while before we get an answer. 42% of all cancer cases and almost half of all cancer deaths in the most recent year for which we have statistics were due to modifiable risk factors. It's excess body weight, it's alcohol, it's diet, and it's physical inactivity. Which means that almost all diseases can be improved or prevented if we're in an optimal state of wellness. And again, that doesn't mean we can get rid of everything. Maybe in a year or two, someone's going to tell me, Dr. Waxman, you have pancreatic cancer. I couldn't have prevented that. But if I'm in an optimal state of wellness, if I've trained my mind, if I've done all of these other things, I am going to handle this and deal with this in the best possible way so that I can make as meaningful as possible whatever days I have left on God's green earth. So I strongly believe that all of these things are beneficial. Whether or not they end up preventing a cancer or not, they may or may not. I don't know. But I don't smoke, and I'm not sure that it's very likely I'm going to have problems with cardiovascular disease until perhaps very late in my years when I'm old, 110. In addition, we can handle our challenges of life far better if we're in an optimal state of wellness. And that's why Dr. Shulock wrote the book which we call Should I Fire My Doctor? It's not should I fire my doctor, it's should you partner with your doctor to implement 11 essential elements that lead to health and happiness. And some of you may have attended some of the seminars that she has put on over the last year or two here, or seen some of the videos on Train Track that all help to implement and integrate this program into the lifestyle of this university. And it includes exercise. We've already talked about some of these things. My goal for the upcoming year is to work on my flexibility, and that means maybe adding yoga to my lifestyle. Because we don't stop being active because we get old. We get old because we stop being active. Look at this dude. His name is John Nagy. He lives in Canada. He walks to the gym, he gets on his weight program, and then he walks home, except when it's snowing. How old is he? He's 97. He's 97. This woman here is a female bodybuilder. I would submit she has muscles. I would submit she's damn good looking. This is Ernestine Shepard. When this was taken, she was 74 years old, the oldest competitive female bodybuilder in the world. And the interesting thing is she decided to change her lifestyle and get into a lifestyle of exercise and taking care of her body in her 50s. This was not something she did lifelong. Robert Marchand. I stole this picture from the front of the New York Times. 105. After setting a new 1-hour cycling record. Yes?
I have a question that I guess falls in the category of exercise physiology.
Yes.
But as you get older, what is the recommendation regarding trying to strengthen yourself, not to be a muscle builder, but just to be strong enough to function well? I've heard that as you get older, you should give a period of rest between rounds of exercise. So going every second day or third day to do certain routine exercises with weights or whatever is better than doing it every day. Giving
Right.
the muscles more time to recover. I don't know about that.
the question dealt with if you're an older individual, some of the measures or precautions you might take when initiating an exercise program, and whether or not maybe giving your body some rest between workouts is a good idea. And I'm a urologist, not an exercise physiologist, but I will address that a bit. You are right. It's not only the exercise that's important, but it's the period of recovery afterwards to allow your muscles to rebuild. And for that reason, I myself exercise, if you will, in a circuit. On day 1, I may work on exercises that involve my upper body. Day 2, I'll work on my lower body. Day 3, I'll work on cardiovascular, usually with an elliptical, because my knees are not so good and running is not something I do anymore. The next day, I may go back to the cycle and go 1, 2, 3, or I may take a day off. So the net effect is, each week, I will work on exercises of one body part maybe twice. So I believe that rest and recovery is very important. And if you are thinking of starting an exercise program, first of all, let me advise you to consult with your healthcare provider, because your situation is unique. You may have some heart problems that the provider may want to caution you about, or a blood pressure issue they may want to correct before you begin on an exercise program. And so be very careful. The same thing if you have some orthopedic issues. Make sure a doctor who knows about your problems gives you the right advice and tells you what you can do and what you can't do. Now, if you have the resources and you've been cleared to go with a workout, it might be very helpful to work with a physical trainer, a personal trainer. Those folks are especially attuned to the needs of both their younger clients and their older clients, and they can guide you and help you without hurting you. So if I were in your shoes, fortunately I have the resources, and if I were starting from ground zero, the first thing I would do would be to hire a personal trainer, get some ideas, have them construct a workout program for me, have them take it through me, have me go through that program for a few weeks. Once I learned what they were telling me to do, I'd say, thank you, goodbye, and then I do it myself. So get advice, make sure you're cleared, and you might consult with someone who does this regularly if you have the resources. Or read about it. There's a lot of stuff on the net. I love this one. Look at this race. The woman with the shock of white hair on the left is Hurricane Hawkins. She's going to lose this race. She's also the oldest one in the race. I think the competitor who's about to win is about 80. That lady in the black with the shock of white hair is 101. And she's going to make it. Hurricane Hawkins. So again, just because you're up in years does not mean that exercise can't be part of your lifestyle. In fact, I submit it ought to be part of your lifestyle, because there is a natural loss of muscle from us as we age, called sarcopenia, if we do nothing. But you are not doomed to loss of muscle mass, but if you want to maintain your muscle mass, you will have to do some type of resistance program. Not only that, staying fit is excellent for your cognition. This study looked at women and dementia. The highest levels of fitness in this population were the ones with the best cognition and the smallest problems with dementia. So exercise has all kinds of wonderful benefits. And in fact, in my estimation, and I'll state it here at A&M, there is no fountain of youth, but the closest thing I can think of is exercise. In addition to, of course, dealing with some of those things which may be hindering you from being the best possible version you can be. My wife put this slide together to remind us that all of these things might be adversely affecting our lifestyle. And for each of us, it could be different. Could you be smoking too much, or any at all? Perhaps a little bit too much to drink. Are you spending more time at work and ignoring important relationships? Are you susceptible to pornography? Or could it be other issues, such as not managing your money? Could you be surfing the net into the wee hours of the morning, as I am occasionally wont to do? Just remember that optimal wellness also means avoiding those things which are getting in the way of your achieving that health. So these are the first 4 elements that Dr. Shulak talks about in her book. Normal numbers now, and we've talked about those, your blood tests, measuring your cholesterol, measuring your blood sugar, critiquing what you eat, avoiding a lot of carbohydrates and maybe adhering to a Mediterranean diet, or at least not eating to excess, making movement mandatory, getting into some kind of program where you exercise or move, or finding an occupation where a lot of that is required, and halting your harmful habits. To remind you, these metrics here have been gathered by the American Heart Association. There are 7 of them: a normal cholesterol level, a normal blood pressure, normal blood sugar, normal weight, you exercise, healthy food consumption, and no tobacco. Any idea how many Americans, what percent of the population fulfills all 7 of these metrics? I see some grimaces. 1%. 1% of the population. I'm in that 1%. And why should you worry about that? Whoops, I guess I went too fast. There are well-documented studies in the literature that show that these issues have a dramatic impact on premature death and disability. Cancer, heart disease, stroke. Just doing these 7 things. If you did nothing else or took away nothing else from what I've said here today, if you might focus on paying attention to these elements and working on them, you will do wonders for your life and your future health, and your loved ones will thank you. You can get this form, which has all of this stuff listed, by going to livingwellaware.com, and it's free. What is number 10? Pause, ponder, plan, and pray. And I alluded to that, at least in my lifestyle. Meditation is different for different people. There's no one meditative practice. There are plenty of apps in this day and age that you can download and put on your smartphone. There are many programs. There's a lot of free stuff on the internet. My wife and I adopted this practice several years ago, and it's hard to measure the impact, but I know with certainty there are certain unexpected events that have occurred to me over the course of these 3 years where the fact that I had taken time to prepare myself mentally at the beginning of the day undoubtedly had an impact on the way I chose to deal with the adverse event that hit me, and just made my life as smooth as possible under sometimes extenuating circumstances. So we want all of you to invest in the best information, implementation, and inspiration. Hopefully today, in this brief period, we've given you some food for thought, maybe told you something you didn't know. We want you all to try and adhere to these 11 essential elements. And my question to you, do you need to work on any of these? I do, and I don't think I'll ever stop working on them until they lay me down and put that gravestone in front of me. But at the moment, I'm alive and kicking and intend to continue working on them as long as I possibly can. So I want to thank you for your time. I'm going to wrap it up here and leave the next 5 minutes or so open to any questions you might have. It doesn't necessarily have to be about any of the men's health issues I talked about. If you have any questions whatsoever on the subject of wellness, lifestyle, etc., I'll try and answer it if I can. Thanks. Well, I really appreciate, again, all of you coming. I honor you for thinking enough about this subject to take time out of your very busy day to come here, each and every one of you. And again, hopefully there will be some food for thought that you'll take home and be able to share with other folks. Thanks again. Oh, I guess I should also mention one other thing. Some of the things I've alluded to, if you don't have them, next door in the room where the women are going through their seminar, we have some of these for sale. My wife's book, if you don't have it, Should I Fire My Doctor?, which details these 11 essential elements. To complement that is a workbook which goes into great detail how you might consider implementing these 11 essential elements into your own life. A lot of suggestions, a lot of references, good concrete examples. It's a very thorough guide to a very healthy lifestyle if you so choose. And finally, if you would like to even make more progress, you can document it. This is essentially a journal, a week-by-week way you can chart how you move through these 11 essential elements. And the journal was essentially or especially designed to focus on the goals that are discussed in these books, so that it's a nice partner or complement to this. These are all available at livingwellaware.com and can be ordered online, but if you are at all interested, we have some copies next door at a severe discount because we love Aggies. I believe my wife said $40 for this combination here. Ordinarily, that would be at least 2 or 3 times that much. So if you're interested in any publications that go along with what I've had to say, they'll be available next door. Thank you.